car is a good example. When you are buying the car, you don't need to the car engine in detail, but you have to know that how to drive. Okay, otherwise you cannot use the car. The same as in the laser, you have to understand the not laser physics in detail, but you have to know that the characteristics of the laser. Dermatologists know that the characteristics of the skin. So that information, characteristics of the skin and the characteristics of the laser combined together, and then you can find some solution how to treat the skin disease. That's why the dermatologist should know not physics but the characteristics of the laser. We have to understand the laser tissue interaction. We have to know what is the wavelength which we used, and what is the perspiration, and what is the energy, what is the power. Okay, this is the main characteristic of the laser. In the skin-wise, what kind of the disease we have? Is the dermal disease or the epidermal disease? Depend on the location, we have to choose the energy and the wavelengths, because we have to know that how much penetration depth we need, because all the diseases are located different level. We have to choose the wavelengths first, because the penetration depth is depend on the wavelengths and then energy. When we increase the energy, and then we can increase the penetration depth. And second one is how much energy we used. That one is very important things to avoid the side effect. Main things of the side effect which when you are using the laser is burn. Normally in our skin, we have the three kinds of the chromophore. First one is melanin, second one is the hemoglobin, third one is water. If you want to treat the pigmentation, we have to think about the hemoglobin absorption and the melanin absorption, not the water absorption. So you have to find which disease is located. It's the dermal side or the epidermal side. According to the depths, you can choose the wavelengths. If you want to ablate the skin, the main chromophore is water, so you have to choose the wavelengths. Normally, what you have for the ablation is 2.94 micrometer wavelengths is the Obimya, and then 10.6 micrometer is the CO2 laser. So you have to choose which one is better for the treatment. This is very important things. When you treat some kind of the disease, you have to choose the wavelengths, and then perspiration, the energy, and then absorption coefficient. When you treat the pigmentation, and then you have to look at the absorption coefficient of the melanin, and then when you do the treatment with the vascular vein, you have to look at the hemoglobin absorption coefficient. Also, when you ablate the skin, you have to think about the absorption curve of the water. This is very, very important things.